One of the most fundamental clinical trials in cancer came out in February in the New England Journal of Medicine, where they took women who were premenopausal with breast cancer, so about the worst kind of breast cancer you can get. They had gotten their chemotherapy, and then they randomized them, where half got placebo, and half got a drug called zoledronic acid that builds bone. It's used to treat osteoporosis, and they got that twice a year. They looked, and in these 1,800 women, given twice a year a drug that builds bone, you reduce the recurrence of cancer by 35%. Reduce recurrence of cancer by a drug that doesn't even touch the cancer. So the notion you change the soil, the seed doesn't grow as well. You change that system, and you can have a marked effect on the cancer. Nobody has ever shown, and this will be shocking, nobody has ever shown that most chemotherapy actually touches a cancer cell. It's never been shown. There's all these elegant work in the tissue culture dishes that if you give this cancer drug, you can do this effect to the cell. But the doses in those dishes are nowhere near the doses that happen in the body. If I give a woman with breast cancer a drug called Taxol every 3 weeks, which is the standard, about 40% of women with metastatic cancer have a great response to that drug. And a response is 50% shrinkage. Well, remember, that's not even an order of magnitude, but that's a different story. They then recur. I give them that same drug every week. Another 30% will respond. They then recur. I give them that same drug over 96 hours by continuous infusion. Another 20 or 30% will respond. So you can't tell me it's working by the same mechanism on all three sides. It's not. We have no idea the mechanism. So the idea that chemotherapy may just be disrupting that complex system, just like building bone disrupted that system and reduced recurrence, chemotherapy may work by that same exact way. The wild thing about that trial also was that it reduced new primaries, so new cancers, by 30% also.